Clarissa Sabattis. I'm the tribal chief of the Houlton Band of Maliseet Indians. I have not been able to receive the vaccine. Um, I did have COVID in December of 2020 and have had some lasting effects from COVID. So I've chosen to wait. However, um, if I had had the opportunity to get the vaccine prior to contracting COVID, I definitely would have done so. I I I trust in the vaccine, and I would have preferred to been protected and not have to deal with um, the effects that I have been over the last few months. I had lung pain
Mhm.
and it was really weird. I've never felt that before, but I had actual lung pain and then it um so I didn't have um the respiratory symptoms that I expected, but I started getting hives when like the day that I knew I was getting sick, and I've had them ever since. And so anything that causes any food that causes inflammation, which is like a key thing that you see with COVID, I can't eat now. I am looking forward to getting the vaccine for multiple reasons. I have elderly parents that I take care of, and that's first and foremost. My priority is being able to be around them and take care of them and not put them at risk because I don't have a choice. They need my assistance. So um no matter what, whether there was a vaccine or not, I had to be there. So this for me is another way to ensure their safety. For my family as well, for the community. I It's been really challenging to not be able to be um, in the community. And I there are times when I'm doing stuff to assist an elder or someone else, and it really um, has been difficult, and it's made me worry about you know contact, because I the worst thing that for me would be to give COVID to one of our elders or one of our community members. um, but I also, for myself, I you know I believe in the safety of the vaccine. I know that that they have documented some side effects, but I think that if I had a choice between COVID and a side effect from a vaccine that's mild, I would choose the vaccine. So regardless, my plans are that once um, these things subside, I would like to have the vaccine. I I think that it's important for our community members and our staff, leaders, to get the vaccine for the safety of our overall community. Our people that are at increased risk for succumbing to this disease, and I think we need to do everything that we can to protect ourselves. I and there are people that absolutely can't get it, even though they may want it, and to me, it's my responsibility to do all I can to protect those people as well. I have um, I've spoken to a lot of people, majority elders, just checking in to see how they've tolerated the vaccine, and I've received a lot of good feedback. Again, like I had said before, there's mild symptoms for some people. Some don't feel well for a little bit, but overall, I've gotten a lot of good feedback, and people that haven't even had any symptoms after the first or second vaccine, and feeling, the feeling um, of hopefulness, that we're getting to the other side of this, or we're heading that way at least, I think helps as well. So it's not only do people feel better about being protected, or having increased protection from this virus. It's that hopefulness of, we're headed in the right direction and we're going to get there, and hopefully things will return to normal.